Welcome again. We want to talk about cardiac arrest and what you should know about cardiac arrest. What is cardiac arrest? At times, some of us think cardiac arrest is the same thing as heart attack, but there is a bit of difference. So, cardiac arrest or sudden cardiac arrest is when your heart suddenly stop beating, and afterward, no pulse because there is no enough blood getting to your heart. And without enough blood, your brain and your body stop getting oxygen as fast as possible. And what happens? You quickly lose consciousness, collapse, and of course, stop breathing. And if that happens, at times your pulse stops. You understand? And of course, you might feel dizzy or lightheaded before it happens. It has a whole lot of signs that it gives, but most of the time we don't usually pick it on time. You may also experience a chest pain or a sick feeling or shortness of breath. Your heart may beat really fast right before it stops. But I want you to note something, that cardiac arrest can happen without any warning sign. Sometimes. At times when your heart runs out of electricity, there's something like electricity because our heart conducts. Certain problem can mess up the signal that keeps your heart pumping like it should. And of course, these glitches can, of course, now cause irregular beat or what we call arrhythmias. And we have various types. There are different kinds of arrhythmias. But most of the times they are not harmful. But despite the fact that they are not harmful, there is one thing we call ventricular fibrillation. That is one of the things that's most likely to trigger cardiac arrest. You understand? Then at times, heart disease has been linked to most of this cardiac arrest. For people that have previous heart diseases like coronary artery disease, or even they have ischemic heart disease, and inside the heart there's something like plaque that built up in your blood vessels, like, you understand. And what can this do? It can slow or stop blood from flowing right into the heart. And of course, that can cause heart attack that hurt your heart cells and of course the electrical system. I told you that the heart conducts electricity, not the kind of one we use at home. Then what are the other causes of cardiac arrest? Number one, certain gene in our body raises the risk of arrhythmias, which can of course lead to cardiac arrest. And sometimes other causes of cardiac arrest might be major blood loss or serious lack of oxygen at a particular time, maybe due to intense physical activity. You understand? When you are doing rigorous activity or you are carrying load or you are being hyperactive, especially if you have heart problem before. And at times there are people, some of us are born with heart defects, where the fact that that shows structural changes in their heart. It won't be the way it's supposed to be, either from problems or an infection. At times it might happen because of less or little potassium or magnesium in our bloodstream. At times it might be as a result of hypertrophic cardiomyopathy. These are just heart diseases that can cause it. And when we're talking about this hypertrophic cardiomyopathy, it can thicken your heart muscles. When the heart muscle, assuming it's supposed to be, and it's thickened. And of course, when it does that, the contractility and relaxation will reduce. And this will inadvertently reduce the blood flow through your heart. And of course, because of that, it can disrupt your heart electrical system. You may get an abnormal heart rhythm called ventricular arrhythmias, and it may happen because of one of your genes. Then, of course, high blood pressure, or at times it is of unknown reasons, which we call the idiopathic cause. And of course, when we're talking about, unlike cardiac arrest, your heart keeps beating during a heart attack. cardiac arrest, you stopped breathing, your pulse stops. But when we're not talking about heart attack, your heart keeps beating, but blood flow gets cut off, which means your heart doesn't get enough oxygen. Of course, what would that do? That can cause damage to your heart muscles, and it is not funny, because these are two distinct conditions and they are also linked together. A heart attack can disrupt your heart electrical system and lead to cardiac arrest. You understand? A heart attack can lead to, heart electrical system with a problem with that and lead to cardiac arrest, not heart failure. But there's difference between them. But either cardiac arrest, either cardiac arrest or heart attack, most of them are dangerous for us. And I want you to know, cardiac arrest is a sudden life-threatening event. Cardiac is a sudden life-threatening event. It can threaten life. Heart failure is serious, but it does not mean that your heart has stopped. That's just the difference. Then it's just that your heart muscle is weak, and at some point it will not be able to pump blood, as it were, at least oxygen-rich blood to the rest of your body. And what happens consequently, this can leave you feeling out of breath, tired when you do anything active, including the normal house chores that you do, including the normal brisk walk that you do, including walking just around your house. You understand? So at risk, what are the risk factors for cardiac arrest? Number one, the risk factor, your chances of cardiac arrest are at high level. Your chances of cardiac arrest are highest if you have heart disease before, but your odds can go up if you have a personal history, family history, or you have arrhythmias, which is a problem with the heart. If you are an older male, you have a risk. If you smoke or misuse drugs or alcohol, you are at risk. Maybe you have had more than one heart attack, or more than one heart attack in the previously. You are at risk. If you are a diabetic patient or an hypertensive patient, you are at risk. Heart failure or kidney disease before, you are at risk. If you are obese, you understand, it is possible for you to experience that. At times, it might be intense emotion, strong feeling that can cause deadly arrhythmias in some people. That is why we are supposed to be able to control our anger. So at times, out of control anger is the most common one linked to cardiac arrest. But apart from that, extreme shock, either good or bad shock, you have something, good news, and you are like that. You have bad shock, and you are like that. Powerful sadness and other negative emotion may mess up with your heart electrical system. And like you know, on this page, I preach preventive health. So how do we prevent it? We have to start with your diet, which is very, very important. But at times you might not always be able to prevent cardiac arrest. But what can you do? You can make some lifestyle changes to lower your chances of heart diseases or serious events like a heart attack. So for we starters, it is better to eat a balanced diet, low in added sugar and salt, reduce your processed foods, eat plenty of vegetable, plenty of fruits, healthy fat, that is the good cholesterol, whole grain, lean meat. Lean meat is when you boil your turkey or chicken and you remove the skin. Then, of course, you might visit your dietitian or you talk to your doctor. They have various plans that they can give you. And under the prevention, you may get regular exercise. It is recommended that we should do exercise of 30 minutes per day times the whole week. That's about 150 or thereabout, maybe 5 times a day. Learn relaxation technique, manage your stress. If you are a smoker, quit smoking, because this lower your odds of heart risk and, of course, cardiac attack. And, of course, it make recovery easier. Maintain a healthy weight if you are obesity, because obesity play a larger role in heart disease. If you are younger, if you're 34 or younger, manage your health problems or manage high blood pressure, high cholesterol, diabetes can all hurt your heart. Health is wealth. Take care of yourself. If you have learned one or two things, kindly follow, subscribe to my channel. See you in the next video.